Hi, my name is Alan Unell, and I write healthcare advocacy on Substack, and we produce these series of videos on healthcare reform advocacy. Each will have a problem that we can all address and take action on. But today I want to start with some good news. In some of the writings we've done, I've mentioned previously that my family has more than their fair share of cancer victims. A number of my friends also have cancer, and so every once in a while, it's good to see that there's some good news that's hopeful. There have been a number of recent advances in treating cancer, and I want to share a few of those with you. According to the World Economic Forum, cancer kills about 10 million people across the globe yearly. Breast cancer, lung cancer, and colon cancer are the most common. There are some new treatments coming about. Not all of them are more effective. Some of them maintain effectiveness, but they're much faster. In England, the National Health Service has found that they've developed an effective 7-minute injection, replacing the hour-long infusions of alitazolizumab or Tecentriq. Forgive me if I got those wrong. Those are used to treat lung cancer and breast cancer for about 3,600 patients in the UK. What that means is that 3,600 people will get to save about an hour a day, and so will the doctors and the healthcare staff. So that's good news. Lung cancer kills more people in the US yearly than the next 3 deadly cancers combined. It's notoriously hard to detect in the early stages of the disease with x-rays and scans. But scientists at MIT have developed an AI learning model, don't run away from AI, that predicts a person's likelihood of developing lung cancer up to 6 years in advance using a low-dose CT scan. Trained using complex imaging data, the product is called Sybil, can forecast both short and long-term lung cancer risk, according to a recent study. We found that while we as humans can't quite see where the cancer is, the model still has the predictive power to determine which lung would eventually develop cancer, said the co-author, Jeremy Wolland. Here's another one, CAR T-cell treatments. A treatment that makes immune cells hunt down and kill cancer cells was recently declared a success for leukemia patients. The treatment, called CAR T-cell therapy, involves removing and genetically altering immune cells, called T cells, from cancer patients. The altered cells then produce proteins called chimeric antigen receptors, CARs. These recognize and destroy cancer cells. In the journal Nature, scientists at the University of Pennsylvania announced that 2 of the first people treated with CAR T-cell therapy were still in remission, get this, after 12 years. Outstanding. Precision oncology. I want to tell you, my mother's oncologist. He proclaimed that this was going to be the future together with genetic makeup. I'm glad this is really making progress because of that. Precise targeting, personalized treatment based on your genetic makeup. Decades ago, as I was mentioning, my mother's oncologist said this would be the best hope. It involves studying the genetic makeup and molecular characteristics of cancer tumors in individual patients. Because precision oncology treatments are targeted, as opposed to general treatments like chemotherapy, it can mean far less harm to healthy cells and fewer side effects. Here's another one. Pancreatic, ovarian, bladder cancers. Let's look for early detection. Generally, all of these are incredibly deadly, and often because they're so hard to find early enough to treat. When tumors are detected before spreading, the 5-year survival rate for those is about 60%. Otherwise, it's less than 5%. And by the time most people find out they have things like pancreatic cancer, they're lucky if they get a couple of months. Now, by focusing on intercellular communication paths, researchers at the University of California, San Diego, found they were able to detect, get this, 95.5% of stage 1 pancreatic cancer, 73.1% of stage 1 ovarian cancer, and 43.8% of stage 1 bladder cancer. This is like a miracle. The earlier the detection, the higher the likelihood of successful treatment. all of these stories, I'm going to put links to them in the box below. So summary, a long way to go, but very, very hopeful. Let me talk about health insurance shenanigans, because I can hardly pass a day without pointing a finger at people who have their hands in our pockets and are looking to make a buck off of our need for health care. Shenanigans is really too lighthearted a word, but private insurers are getting ready to deliver $1.1 billion in rebates this year for overcharging Affordable Care Act participants. Can you believe it? There's a link to the story that I'll put below from the Kaiser Family Foundation. The rebates are the result of insurance companies not meeting the ACA's medical loss ratio threshold, which requires insurers to spend at least 80% of premium revenues, 85% for large groups, on healthcare claims or quality improvement activities. There's sort of a limit to how much profit they can make. But wait, there's more. ACA marketplace insurers are now requesting, get this, a median premium increase of 6% for 2024. So we have to give money back, but we're going to charge you more next year. I'm so tired of this. We have to force them to give rebates, and then they just charge more. Okay, we know what the answer is. You know, universal single-payer health care. House Resolution 3421, HR 3421, improved Medicare for all. Now, I know you hear this from me over and over again. We have to tell our legislators this over and over again until they're tired of hearing it and they believe that their jobs are on the line unless they get this passed. So let me tell you the action. We all deserve an affordable health care system that works for all of us. Let's let our legislators know. I'll put a link to their contact information in the link below, in the box below, so you can call them or email them if you wish. Otherwise, I have a prepared email that you can send to them. All you have to do on your cell phone is text to the recipient 50409, put in SIGN PTLLDV, and I'll put that in the link as well. And you can let your legislators know how important it is to you. Okay, that's what I have for today. Please like, share, subscribe, and I'll also put a link in for healthcare advocacy on Substack, and you can be a subscriber there too. Have a good evening.